Hey everybody, how you doing? Uncle Vinny here. You know what's coming up? That's right, Health Chat. Grab a cup of coffee, sit back, relax, and enjoy the show.
Hey everybody, I'm Dr. Nick Circolone. You're watching Health Chat. I am so excited to be here as always. Listen, last week we talked about the gluten challenge. Hopefully you guys are doing really good with that and that you're feeling better, you're decreasing some of your carbohydrates and you're taking away some of your sugars and you're starting to feel better. I'm hoping that you guys are trying to stick with that. Sometimes we do, sometimes we don't, but you know what? If you fell off the bandwagon, just get back on and don't worry about it. Well, today I have a special show for you today. We're going to be talking about low back pain and a modality I really like called spinal decompression or lumbar traction. The lumbar spine causes a lot of problems. 65 million Americans are suffering with low back pain. It is the number 6 most expensive cost for healthcare. Number 6, that's a lot. So that means a lot of people have the problem. A lot of people are getting treated for it. Some are getting treated effectively. Some are treating it not so effectively. Now, there's a lot of treatments out there, anywhere from manipulative therapy all the way to surgery. We're going to be talking about one today, and that's decompression. So let's get started. The spine is a wonderful and beautifully made. God knew exactly what he was doing when he created it. But it does have a problem if it's injured. But you know what? We can work on some of that, we can heal some of that, we can fix some of that in a lot of cases. And decompression is just one modality that we use to help facilitate that. Okay, so we have the lumbar spine. I have my friendly spine here, and we're going to be talking about that. Well, back here, right in this area right here is called the facets. Now, as we get older, we develop arthritis. Well, where does that arthritis go? A lot of it affects this facet joint here. We also have a disc. This is kind of a representation of a disc bulge. What this does is it presses on a nerve, causes pain, causes radiation into the leg. And what we're going to be talking about with the decompression is how we pull those apart gently to decrease that pressure, whether it be the facets or whether it be the discs. Now, let's start with the disc first. The disc is a soft tissue. So if you've ever gone and had x-rays taken and somebody said, hey, you have a bad disc, you really can't see the disc on an x-ray. But what you can do is you can extrapolate because you'll see a decrease in the disc height from point A to point B. And what that does is it says, yeah, the disc is probably involved, but it does not necessarily mean it is. We can only extrapolate that. You cannot see the disc on an x-ray, but you can see the disc on an MRI. We use an MRI because it's a little more specific for disc type lesions. And if that disc is bulging or pressing on a nerve like this one seems to be doing, what we can do is we can literally traction that apart, pull it apart. That way that disc pulls that pressure off of that nerve. Now, if you get the pain gone, does that mean that the disc is better? No. What that means is that we've taken enough pressure off of the nerve to stop you from having symptoms. I've had patients ask me this before. If I have low back pain and I get decompression therapy, will my disc go back into play? Not necessarily. What we're doing is we're taking that pressure off. It only takes a little bit of pressure to cause the pain, and it also takes a little bit of pressure to be pulled off of that nerve to decrease the pain. So can the discs go back where they were following treatment? Sometimes. I've seen patients where the discs have been reabsorbed over years, but not right away. So don't think that once you get the decompression therapy, once you get this modality, once you get treatment for it, it's going to be gone. No, it's still going to be there, but it's going to be lessened. The faster we can get to something like this, the better off we're going to be. I will say this. There are some acute situations where decompression therapy will not work. Like if somebody's working and all of a sudden, boom, they have a blown out disc. The chances of decompression working right away are not really good. So we'll have to do other modalities. Sometimes we'll have to use medication to get it done, and even sometimes we might have to get surgery. But we're talking about something that becomes a more stable condition where we can use a modality such as decompression therapy. If this is helpful for you, please just subscribe to our channel. One of the other things that we talked about is the facets. The facets are probably one of the easier ones that we can deal with decompression therapy. If this area right here, this facet that we talked about, becomes inflamed or irritated, what it will do, it will also affect this nerve. If it affects this nerve, you're going to have the same type of pain. The difference between a facet type pain and a disc type pain is how far down the leg does it go. This is not all the time, but majority of the time. If you have a disc, it usually runs all the way down into the foot. With a facet, will only run probably to the knee. Is it a disc? Is it a facet? It could be both, but that kind of gives you an idea of which one it possibly could be. Now, people call it the same thing. They'll say, oh, I have sciatic pain, but it's not going down to the foot. And that's one of the questions I do ask. Is like, where does your pain radiate? Does it go all the way to your foot, or does it go to your knee? If it goes to your knee, we know more than likely it is a facet. If this area is a facet, the traction seems to work a lot better. Why? Because that area is easily manipulated normally. So as we're stretching that, as we're getting axial traction and pulling that apart, it's going to feel a lot better. Also, if you have facet type irritation, we'll be able to not only get it with traction, but we'll be able to do it pretty quickly with just light manipulative therapy as well. Now, we can do that with the disc, but it takes a little bit longer. Discs take a little bit longer to heal than the facets do because the facets are more chronic. They're more irritated. They've been there for a while. If we have facet type pain, we're also possibly going to have a disc problem. Remember what I said earlier? On an x-ray, you can't see the disc, but you can see the degenerative changes and assume that the disc is involved. So don't think because you have one type of pain doesn't mean that it can't affect the other areas such as the disc. So all of this, to be stretching it apart, to opening it up, will make the joint feel better. One of the things that's really important though, once the pain itself goes away, what do we do then? You, as the patient, have to do your duty and do the rehabilitative exercises that you're given. Those will help protect that area, help decrease the pain in that area, help prevent it from injuring itself again. So there's a certain amount of work you're going to have to do. Don't expect the doctor to go, okay, you're good, let's go. Here, just take a pill, on your way. Let's just stretch you, you're on your way. No, that's not how it works. You're going to have to do some of the work yourself. So if you're proactive and your doctor's proactive, your treatment and your outcomes are going to be so much better. Now, I will tell you this, little caveat. Next week, we're going to be talking about some exercise to help with facet syndrome and some disc irritation. So stay tuned next week. Well, guys, listen, have a great day. I love you. Stay tuned for next week's show. If you like what you hear, please subscribe, and we'll see you next week.